Welcome to the next module on patient care documentation and athletic training. And in this module, we're going to talk a lot about the what, when, and how documentation occurs. So let's start first with what to document. So the best way to begin this is by talking about a definition of what a patient encounter is. And this is the most important thing that you're going to need to define when you're trying to determine what you should or shouldn't document for a patient. So a patient encounter, as defined by the best practice guidelines for athletic training documentation, is any encounter that has an interaction with a patient when an athletic training service is provided or communication occurs regarding their health status. And that communication may include, but not limited to, verbal, written, or electronic communication with any individual or entity. And so this is very important to talk about. So when we're here, a patient encounter should be something and has to be something that we document. So within a patient encounter, if a patient walks into your athletic training facility and you give them some sort of advice or ask them how they're feeling or check in with them about an injury or illness, this is a patient encounter. What I challenge you to do for you and your patients in the clinic is that you have a policy and procedure written where you actually define your patient encounter for your exact population. And that will help you legality-wise be able to know exactly what you want for your exact setting. That way it's tailored to your needs as much as possible. The next thing we want to define is what a change in patient status is. And so this is another time when documentation must occur. And so this is any time there's an unexpected change or deviation from the expected result, or when an athletic trainer provides a service, evaluation, consultation, a subjective or objective measurement of a status change. So think about this. You're in your athletic training facility and a patient walks in and they talk to you about how they're feeling today, and they talk to you and tell you that they're feeling better, their pain's gone, maybe they're a little bit sore in different places. This is a change in a patient status. And so I like to talk about it a lot, that anytime a change in a patient status occurs, that's basically everyday communication. So this is a fancy way of saying that basically every time we talk to our patients that this needs to be recorded. Now, this kind of brings you into the point of the fact of, if you do an evaluation day 1, you're obviously not going to do a full patient evaluation day 2. So you do not have to re-put into your SOAP note the same exact things that you saw the day before. This is for anything that's changed or check in with the patient. So beginning specifically with athletic training documentation, the first thing we're going to talk about is initial SOAP notes or initial evaluations. So these evaluations occur when their patient first comes into a clinic, first comes into your setting. I'm going to go through each of them individually and talk about some aspects of what should be and are involved in each aspect of the SOAP note. So the S in SOAP note stands for subjective, and within the subjective portion, these are things that there is no way to have a very specific measure to. So these would be things like, as a clinician, I note that my patient comes to the athletic training facility with an antalgic gait. This is something that I observe, and based on what I said, there is no objectifiable manner. There is no specific data given, except that this is not a normal gait. This is also the spot where you get the story from the patient. So the patient reported that he was out on a lacrosse field when he stepped in a hole. He felt that his ankle turned inwards, and that would be in quotes, and that he felt a pop. That kind of information is all subjective. It's all what we are told and have not been able to put a specific measure to. Subjectives also where you can put things like the patient reported if you use a generic pain scale, like a 4 out of 10. And the reason that that's more subjective than objective is there's no way to specifically measure this. I can't tell my patient how they're feeling, and there's no very specific way of saying, okay, this person right now is at a 4. Once we head into objective, this is more of that quantifiable, that information that you're able to delve directly into. So an objective measure for a SOAP note would be something in which you have a specific measure. So if I am measuring swelling in the ankle and I use the figure 8 method, and I can note how much swelling is in the ankle, that's objective. Getting patient-reported outcome measures and getting those specific numbers of the different scoring that can happen, this is an objective measure. This is where you should be putting your goniometric measurements from range of motion, your manual muscle test grading within your objective section, and all that information that you are able to get a number and you're able to check again and again and see how the injury has progressed one way or another. We're then going to move into an assessment. I also like to debunk the myth that a lot of athletic trainers still have. As athletic trainers, we are allowed to diagnose, and that is within our scope of practice. So this assessment is going to be whatever you determine is wrong with the patient. And you know, in your initial SOAP note, it is okay to not have a definitive answer. Putting words like probable or differential diagnosis will allow you to have that ability to continue on and maybe get further examination or further imaging to confirm or show what your diagnosis may be. Then once we hit within the plan, this is what you are going to do with the patient. This should have two different types of measurements. This should have short-term and long-term, because we know that ultimately the patient is going to have goals that they want right away and goals that are going to be more attainable down the road. And so making sure that you follow like a SMART goal idea, so that's specific, measurable, attainable, realistic, and timely in every goal will be very beneficial for both you and the patient. I'm going to talk about some common errors that we commonly see within SOAP notes. So things that people forget to do within their initial evaluations or within larger evaluations is the visit number. So how many visits has the patient had up until this point, and which number is this? They also forget to list the treatments in time. So if you saw a patient and you worked with them, let's say that you performed Graston technique on them and you did that for 10 minutes over the flexors of the arm, then you would need to specifically put that you did the 10 minutes. Another common error that we see is a failure to sign in datal entries. And a lot of times people think, oh, my electronic medical record may do this for me. This is something that it's very important to start doing, is at the bottom of every SOAP note or every evaluation that you write, put your name, the date, and the time that you have just completed this. Additionally, sometimes people forget commonly the treatment modalities or different procedures. Things such as, if this is not the first visit, to go back and have some of that reassessing the objective data and that goals to ensure that this patient is making progress. Every time we look at a patient, we must have a skilled assessment. And also we need to look at things such as non-diagnostic, non-therapeutic, routine or repetitive procedures, because if these are things that we are constantly doing, and if we just put our patients through the same rehab every day, or if we have them go through and do things that are not proven within the literature, then we are not showing that we are truly putting patient-centered care at the utmost, and we are not giving the patient the best possible treatments and techniques to get them back into whatever they are hoping to achieve.